It came early this evening, another sign that it's all going in the wrong direction. On the advice of the chief medical officers, the UK was moved from alert level 3 to level 4, meaning transmission in the community is high or rising exponentially. Earlier in the day, the chief scientific advisor and the chief medical officer had arrived at Downing Street. It was a first. The two men no longer flanking the Prime Minister or the Health Secretary, instead a duo delivering the most solemn of briefings.
We wanted to give you an update on where we see the epidemic at the moment, some of the knowns and some of the uncertainties.
We have, in a bad sense, literally turned a corner, although only relatively recently. And I think everybody will realise that at this point the seasons are against us.
They showed slides to illustrate how the disease is spreading, the age range and where it's hitting hardest. But of all the graphs presented today, two underlined the science that will or may inform politicians. The trajectory of cases in Spain and France and a warning that we may follow this pattern. And another graph, not a prediction we were told, but again a warning. If doubling occurred every 7 days, we would have 49,000 new cases a day by October the 13th and 200 deaths a day by November.
And to make sure that we do not enter into this exponential growth and end up with the problems that you would predict as a result of that. That requires speed, it requires action, and it requires enough in order to be able to bring that down.
The problem with a pandemic or an epidemic infection like this is if I as an individual increase my risk, I increase the risk to everyone around me and then everyone who's a contact to theirs. And sooner or later the chain will meet people who are vulnerable or elderly or have a long-term problem from COVID.
If there was even a glimmer of hope, and it was just a glimmer, it was in vaccines. Sir Patrick saying that small amounts could be available for certain groups by the end of the year, although more likely by early next year.
We clearly are on a trajectory of a high level of hospital admissions and a high level of deaths. The question is what we can do collectively and individually to keep that at a level where the inevitable balances are what we as a society need to feel we can accept and live with when none of this is acceptable.
The government advisors today had a similar message. Do too little and the virus runs out of control. Go too far and you damage the economy, leading to unemployment and deprivation. Just 8% of the population are thought to have been infected, though possibly 17% in London. And the immunity does seem to fade over time, so a warning that until or if there is a vaccine, we need other measures, beginning with hands, face, space. That is, wash your hands, wear a mask over your nose and mouth, and keep a distance. But leaving after a long day at Downing Street just over an hour ago, Sir Patrick and Chris Whitty clearly having told the Prime Minister that this is no longer enough.
Well, the test and trace system in England has been heavily criticised, but today the Health Secretary said it had reached record capacity. This is what we know so far. Test and Trace was launched on the 28th of May. So far, £10 billion has been allocated to the scheme. At the start, tests were performed in 8 Public Health England labs and 44 NHS labs. But frustration at a lack of flow of information meant ministers contracted consultancy firm Deloitte to create a new testing system. It built the website for booking tests and subcontracted private firms like Serco, Sodexo and G4S to run test centres. How much has been paid to these companies is unclear. Swabs are now also sent to a series of so-called lighthouse labs, some of which are privately run, using different equipment to NHS labs, causing compatibility problems when help has been requested. The latest figures show that the number of tests turned around in 24 hours has dropped from around a third the week before to just 14%. If you do manage to get a test and test positive, then contact tracers employed by Serco and Citel will plot your interactions with people during the infectious period. Serco's tracing contract is worth £108 million, but could rise to £432 million if it continues into the new year. Well, our health and social care editor Victoria MacDonald is in Downing Street for us tonight. Victoria, what's the latest from there?
Well, the testing system is still clearly under strain. So we had the Health and Social Care Secretary, Matt Hancock, come to the Commons again today, and he listed the priorities for testing, which he'd warned he was going to publish last week. Those priorities are acute clinical care, so that's hospital patients, care homes, NHS staff, whether it is outbreak management and surveillance studies, teachers, which will be welcomed, those who have symptoms only, and then the general public with symptoms, and also prioritising those in areas of high incidence. No mention of children there, and I think that's a reflection really that children remain largely unaffected by this virus. But it is a message that is very strong now. If you don't have symptoms, don't go and get a test.
And what are you hearing emanating from behind that door about we're all going to hear from the Prime Minister tomorrow?
Well, there is a balance that the Prime Minister will have to eventually, whenever he makes any announcement, will be between grumbling MPs and what the scientists are telling him, that the virus is growing exponentially. They need to do something. But those grumbling MPs have repeatedly said, they don't want a national lockdown, and the government really doesn't want to do that. So as last week we were reporting, perhaps there might be measures like curfews on pubs, and there has actually been reporting in The Sun tonight that that is likely to happen. But you're getting measures in places like Northern Ireland now, where they announced earlier in the day that there will be no mingling between households. So it may be that further down the line there will be tougher, maybe short, sharp shocks where they will introduce, less people in the bubble, or that they will have, where they might have a 2-week, perhaps, lockdown. But again, as I've repeatedly said over the weeks, that is what the government simply does not want to do because of the harm to the economy.
The nuclear option, the Prime Minister described it as. Victoria, thanks very much. Well, as you heard from Victoria, in Northern Ireland, extra restrictions are to be imposed on social gatherings from 6 o'clock tomorrow night. There'll be no mixing of households indoors, with some exceptions, and no more than 6 people from 2 households can meet in a private garden. While in Wales, 4 more council areas will be in lockdown from tomorrow evening, with the number of cases there also rising. Andy Davies joins us now from Newport in South Wales. Andy.
By my calculation, around 850,000 people in parts of South Wales will be affected by these restrictions. That's more than a quarter of the population of Wales. The restrictions announced today will come into force tomorrow evening, and they'll join existing measures which already apply in the county boroughs of Rhondda, Cynnon Taff and Caerphilly. They'll now also cover Newport, as well as the county boroughs of Bridgend, Merthyr Tydfil and Blaenau Gwent. And it'll mean that people can't enter or leave these areas without a reasonable excuse. They won't be able to meet members of an extended household indoors or form an extended household, and all licensed premises will have to shut by 11 p.m. So it's now a uniform set of measures across all of these areas, with perhaps more to come.
This will mean a large part of the population of South Wales and the South Wales valleys will be subject to local coronavirus restrictions. We will hold an urgent meeting tomorrow with all local authorities, health boards and police forces in South Wales, from Bridgend to the border with England, to discuss the wider regional situation and whether further measures are needed.
And it's not out of the question that these restrictions could be extended across all of South Wales.
And of course, the First Minister of Wales has been complaining that he hadn't had very much contact with the Prime Minister. They have now spoken, though, haven't they?
Yes, they have, and we got a very brief note from the Welsh Government today saying that they had agreed on the need to work on a 4-nation basis to discuss UK-wide measures. There is, I think, particular sensitivity here whenever there is a divergence in public health messaging between England and Wales, given the amount of news consumed in Wales which originates in England. And the Welsh Health Minister today said that he thought joint UK messaging this winter would be helpful. So I'm sure that point will be reiterated in tomorrow's COBRA meeting.
Andy Davies in Wales. Now, as you've heard, the Prime Minister had calls today with the First Ministers of all devolved nations. In Scotland, where there are now routinely more than 200 new COVID cases registered a day, Nicola Sturgeon warned stricter rules are imminent.
The Scottish Cabinet will meet tomorrow to take stock, and I'm very clear that it must be in a position to decide the way ahead for Scotland within the next 48 hours. And I need to be absolutely straight with people across Scotland that additional restrictions will almost certainly be put in place in Scotland over the next couple of days.
Well, the government's scientific and medical advisers today compared the situation in the United Kingdom with other European countries which have seen a sharp rise in cases. In the Spanish capital, Madrid, pressure is once again mounting on hospitals dealing with a surge in COVID cases, with over 31,000 infections recorded across Spain in the last 4 days. Partial lockdowns began in and around Madrid today, and local authorities have asked for the army's help in policing them. While in France, the city of Lyon has joined other French regions in imposing tougher restrictions. Our Foreign Affairs correspondent Jonathan Rugman has this report.
Madrid's ambulances are rewinding the clock, delivering so many COVID patients to emergency wards that city authorities are asking for the temporary hospitals, which closed 3 months ago, to reopen. Also making a grim comeback, personal protective clothing. Spain has lost over 30,000 people from over 600,000 COVID cases, the highest caseload in Europe. So this morning, the return of police checkpoints and partial lockdowns in over 30 districts in and around the capital with the highest infection rate. All those needing to travel to work have to carry an official document, with police imposing fines for breaking the rules. Playgrounds have closed again, while social gatherings are restricted to 6 people. Although cafes can stay open with fewer customers, many are opting to shut, and so a reviving Spanish economy is heading into reverse. All this is piling pressure on Pedro Sanchez, Spain's Prime Minister, who was booed by demonstrators calling for his resignation this morning. Because the lockdowns are mostly in poor, working class and immigrant areas, which means tougher rules for them compared with their wealthier neighbours. Discrimination, even if it is based on scientific evidence. Grievances about unfairness were even on display in Madrid's main opera house yesterday, when spectators in the cheaper seats higher up protested about the lack of social distancing compared with the more expensive seats below. In France, Marseille is the biggest COVID hotspot, with French holidaymakers thought to be partly responsible. Today, a partial lockdown was announced in Lyon, joining those in Marseille, Bordeaux and Nice. And what's happening now in France and Spain could happen here.
We've seen in Spain and France increasing cases, increase in hospitalizations, and now we started seeing increasing death. Will also happen in the UK. But as I said, this is not a prediction. This is a potential scenario. It's not an inevitable scenario. The UK still has time to bend that trajectory.
The French have met their target of testing more than 1 million people a week. But there have been complaints about long queues, long waits for results, and laboratories overwhelmed. And the worry is that testing on its own won't curb the COVID surge. So this national advertising campaign urging the French to be less physically sociable, before more of France's elderly and vulnerable people are forced to swap traditional family gatherings for beds in intensive care.
Jonathan Rugman reporting. Now, London's Mayor Sadiq Khan has warned the situation in London is worsening, and Health Secretary Matt Hancock has not ruled out imposing restrictions in the capital. Sadiq Khan joins us now from City Hall. Mr. Mayor, does this mean that you are in direct talks with ministers and with the Prime Minister in particular?
I've spoken over the weekend on a couple of occasions with Matt Hancock. We're in contact again this morning. I've heard nothing from the Prime Minister. I'm not sure whether he'll invite me to the Cobra meeting. What I am aware about is that the testing system in London is not fully functional. We've got Londoners who want to get a test, they can't get one, or they've been sent for a test many, many miles away, or they do a test and don't get the results back for many, many days. And my fear is this is a repeat of what happened in early March, where we missed the start of a spike, and we could have many, many Londoners who have the virus and are asymptomatic and passing it on without realising they're doing so. And so what I'll be saying to the Prime Minister tomorrow is we in London...
Sorry to interrupt, but
that
London chimes with what Sir Patrick Vallance said today, suggesting 50,000 cases a day by mid-October, and that would mean a good number of them in London.
Absolutely. My concern is this. We have got a health crisis. In London, we've still got an economic crisis. And unless we take preemptive steps now, we could have a second lockdown, catastrophic for health, for mental health, for the NHS, for our economy. And that's why it's really important the Prime Minister sits down with not just the leaders of Scotland, Wales, Northern Ireland, but the Mayor of the capital city to work together to try and come up with a set of additional measures to avoid the need of a second lockdown.
Well, now, the Sun newspaper is reporting that one of the measures that will be taken tomorrow is that pubs will be shut altogether. Is that your reading of it? Oh, no, from 10 o'clock, not actually altogether. Would you prefer to have them shut altogether?
No. One of the measures that we've agreed on in London on a cross-party basis is for the amount of time people are in contact with each other to be reduced, particularly when the testing system isn't working properly. And so there's nothing magic about 10 p.m. The reason why the 10 p.m. idea is a good one, though, is because it reduces the amount of time you're spending with other people who could well have the virus, or indeed you could be passing the virus on to in the absence of proper testing. That's one of the measures we call for, and I'm really pleased it appears, according to the scoop from The Sun, the government may be doing. And that's why it's really important for us to learn from each other about what things work and what things don't work. And that's why it doesn't make sense for me for the Prime Minister not to have a Cobra since May, or indeed to have one and not invite the Mayor of London.
Well, now, one of the big surges has been between 20-year-olds and 29-year-olds. That period, that decade, seem to be now contracting the disease. Now, many of them we saw in Soho in large numbers. We've seen them in other venues across London. Are you confident that you can get this genie back into the box and ensure that those sort of scenes do not repeat?
What was clear from 6 months ago from the World Health Organization, that the way to get a grip with this virus was testing. 6 months on, we've made no progress really to get to a grip with the virus in terms of testing. And so unless we've got a testing system that's functional, a contact tracing system that properly works, all we can do is bring in additional measures to reduce the chances of community transmissions. You'll remember that in early March, because of the lack of a testing system, the government reduced testing just to NHS workers. That rationing led to transmissions in the community. My fear is we're going to repeat that mistake this time. And that's why, as London, we've come together to say, look, we want to avoid what we saw in March, April and May. We are volunteering these additional measures to try and reduce the spread of the virus.
But it's absolutely incredible that if there is not a dependable testing system, can you risk large numbers of people in pubs and even till 10 o'clock?
Well, that's the challenge that we've got. And one of the things we're saying to the government is when you look at the numbers who are ringing 111 with the symptoms, the numbers ringing GPs with the symptoms, the numbers going to hospital, it's quite clear, even though the positive test isn't going up, it's quite clear the virus is going up in London. And so we're trying to minimise the opportunity of the virus passing on. So one of the additional recommendations we're making to the government is more face masks being worn in London, not simply in public transport and in shops, but at other places as well where you may come into contact with one another. In hospitality, for all staff, including those in the kitchens to wear face coverings, and wherever possible to reduce the possibility of transmissions being passed on. So if it's possible to have a COVID-secure place of work, if it's possible to go from home to work in a safe way, that's fine. But if it's not possible, to continue working from home.
Mr. Mayor, thank you very much indeed for joining us. Sadiq Khan, Mayor from London.